Hey and welcome to the EYFTM podcast, brought to you by the EYFTM podcast team. This podcast is accompanied by a study on listening behavior. Nadine, what's the study about?
Hey Fabian, I'm always listening to podcasts when I'm on my way to university every day. And I'm sure most of you are listening to podcasts too in your everyday life. But have you ever wondered how different podcasts influence your career choices or your personal life?
Well, if you want to find out more about the study, there's a link underneath this podcast in the bio. And now,
have fun with our EYFTM podcast.
Hello and welcome back to the 14th episode of the EYFTM podcast. My name is Fabian, and after a couple of weeks of quiet, we've actually returned to Germany and we're now recording from Berlin. And as always, I have a very special guest with us today, again with a very special interest. I'm very glad to welcome Dr. Martin Viehweger, GP specialist in Berlin, Germany, who has a vested interest in infectious diseases and sexual health. Thanks a lot for being here.
Thank you very much for inviting me.
Martin, when reading up about your GP practice, it's actually really interesting that you have managed to combine ordinary GP work with your personal special interest. How did you manage to set up a practice with a special interest on sexual health?
It grew on me.
What does that mean? How did you set it up?
It grew on me through the time. I think when I was already in the education, I found out that this infectious diseases topic is quite interesting for many reasons. And during that work, I found out there is a lot of support and help needed, and a lot of understanding is also requested. So I got hooked up to it.
Can you tell us a bit more about how your normal day looks like, your ordinary work day?
I can. I'm not really sure if when we are talking about infectious diseases, how it goes together with sexual health, though. And it probably has not much to do with my daily life, but I start my day with stretching my calves, brushing my skin with a dry brush, taking my bicycle and my overnight oats that I prepared in the evening before and bring it to the clinic. Then I have a very deep moment with my coffee machine, Lady Mocha, that you already got to know.
Thank you very much for the coffee. It was really good coffee.
Right.
Yes, it was very good.
Very good. It's an old coffee machine and very good coffee. And then I mostly have a chat with my team that is slowly coming into the clinic. And I'm setting up my lights, as you can see, and some aroma, and prepare myself for the day.
When I walked in today into your practice, I realized your color scheme is very different to a normal GP practice, or when I say normal, to the practice that I normally know. So you have a lot of red lights, a lot of pink, and it's very colorful. Is that on purpose?
Definitely there's a lot more interior things, plants and old furniture, a bit punk here and there. I think it is important to create an area where I feel the most at home because I have to stay for the whole fucking time. Basically, it's a living room component, and I also think...
It looks a bit like a living room.
Right? And I also think for the people that I'm working with and for these clients, they feel more welcome when the clinic doesn't necessarily resemble a clinic, because most of the people here are marginalized, very often discriminalized, very often criminalized, and they need a place where they can come to and maybe hang out for a moment before they have to open up themselves. I mean, no one has to do anything, but mostly we talk very intimate stuff here.
Yeah. So I guess this being an ordinary GP practice, you probably have your hypertension and you probably have your diabetes. But what would be your typical special interest patients? What would be the typical patient that you see?
It's true, I have them. I also have like really elderly that still are here. We took the clinic from another clinic that was here before, from a GP who got retired, and she was mostly dealing with like elderly people. And many of them stayed, many of them left because of the special interest that we have here. And those that stayed, they feel quite happy. But they also understand that this is really something different and also asked if they may stay.
All right.
Which is, I think, interesting and good to know.
So what would be the typical patient that you now see most of the time?
I see 1,200 people. I don't really see them. This is my like clients that I see every 3 months or once every 3 months. But most of them I see more often than just once in these 3 months or quarter of a year. And I have 1,200 of those kind of patients that I see once or twice or 3 times. A third is transaffirmative care.
What does that mean?
Transaffirmative care is everyone who is in transition, which means like in gender affirming transition with hormones mostly. A third of them is a sort of a sexual health, which means they look for STI checks, education around it, diagnostics, consultation around it. Very often people that are living with HIV, living with hepatitis, people that are doing sex work, and they have those kind of interests that they bring. And then we talk about STI checks, prevention, post-exposure, all those kind of things. That's probably 1/3, maybe even a bit more. And the rest is, let's say, everyday health.
So when these special interest patients call your office, do you have specific days where you change your interest, or is it all mixed?
No one calls. Good luck with calling us. It's terrible. It's impossible.
Okay.
We do mostly everything through email and like online options of booking appointments. And yes, we organized it in a way that when people are looking us up, then they have online a tool to decide whether they want to come for transaffirmative care, whether they are living with HIV and would like to seek care, whether they are looking for STI checks or support, whether they even need to see us, or maybe they just need a routine check that we can organize through the lab. Also vaccination.
So they can pick and choose the type of appointment, and then they get an appointment via email.
They get an appointment, exactly, and a confirmation via email.
Right. Oh, that's very interesting.
It's fantastic.
But besides your clinic days, you're also quite outspoken on other working groups around Berlin. And I think Berlin is a very special scene when it comes to sexual health or also sex education, also transaffirmative care. I guess that's possible because Berlin is such a specific city. The people here are very diverse. Is that something?
Probably not only in Berlin, probably in all the bigger cities where lots of traffic is happening. When I'm talking about sexual health, this is really a term having broad topics. Very often we are talking about sexuality, intimacy. We're very often talking about shame. We are talking about consent or not consent, rape. We talk about drugs. Very often we talk about substance use. We call it sexualized substance use.
What does that mean?
Sexualized substance use is a broader term that tries to understand that whenever we would like to engage with other people, we use substances in order to become more closer, in order to reduce shame, the feeling of guilt because you have a kink, because maybe you have a fetish, you have a special interest, maybe you have a trauma, you need to access your organs, your sexual organs. And for this, in order to become intimate, very often people need something to, to get a little form of drive. I mean, everyone understands drinking a beer, for instance.
I was going to say, alcohol just comes to mind.
Yes. This is already sexualized substance use. If you go to a bar, you drink a beer, have a cigarette in order to flirt with someone, not go home alone or maybe take someone home. And there is a special part of sexualized substance use. It's really a broad part. I'm just cutting it short. Is chemsex. Chemsex is a very special part that has a focus on people that are, for instance, traveling a lot, very well educated, that use very often social media in order to organize their sexual life in very often forms of group settings, group sessions, mostly not only for one night, maybe for several nights with different partners. It is very often men that have sex with men, but we also understood already it's not only our understanding from AMAPs, people that are assigned male at birth and identify as cis men. We also understand it's far broad, also in different spectrum of identity of people that engage sexually with substance use and with online dating application in group sessions, party sessions, mostly at home. and they call it chilling, hanging out, party and play, high and horny. And there you find people that engage sexually with special kind of fetish and kinks and substance use. It is very important to acknowledge that this is a setting that also brings a form of togetherness, a form of hangout and intimacy that is very rare to find in our actual society. And these are places for people to feel welcome, even though maybe they have a fetish or a kink that is normally very often tricky and complex to live with. And those kind of places offer sex and substance use. And these settings themselves are actually not the part that needs therapy or to be pathologized, but very often we find people that are hooked to substance use and their sexuality, and they are not able to unhook it, to disconnect it. For their sexuality, they need substance to make it function again. So they are not like addicted to the substance, but their sexuality is maybe addicted culturally to a substance use. And there we identify a group with higher vulnerability and special needs.
Very interesting. And you're also the founding member of a special interest group or a special working party that focuses on chemsex. It's called BISS.
Yeah.
Is that right?
Yeah. It's a super German word. Bundesinitiative für sexualisierten Substanzgebrauch. We wanted to found an organization so that we are able to build our own workshops, task forces, that we can think about how to maybe educate, to have guidelines or establish guidelines.
And this association, is that open for everyone? Can anyone join or join your workshops if they're interested?
I mean, I could definitely also join an association for football if I would like to. It would be my least interest. So if a person has nothing to do with sexualized substance use, they are welcome to come and give us their money. But if they have no interest, then probably they will be bored, or maybe they will not understand what we are doing.
What kind of workshops do you guys offer?
We offer workshops for education, and we offer workshop in order to bridge more like intersexual working spaces, because we understand that sexualized substance use is not only something for medical professionals. We understand that social work has to do with it very broadly. We understand that outreach and parties have very much to do with it. Collectives that are organizing maybe sex positive spaces, they looking for awareness groups, outreach groups for harm reduction tools. And we understand that we are talking about mostly illegal substances, very often also with sex workers, which is very often also in other cultures illegal. So we talk about something that is maybe criminalized, definitely discriminated. So we also have to think politically, what are we allowed to do? So it is so intersectional that we need to combine those kind of sections and work fields. And for this we understood we need workshops, lectures.
What I found really interesting is Germany is probably very far behind when it comes to the connection between primary care and social work or social prescribing or community outreach programs. And you've pretty much just mentioned all these elements. And when I started preparing for this podcast, I also read something very interesting, that you also go out on nightlife institutions or clubs and help them to become safer. What's your role with nightlife clubs as a doctor?
Personally, I understood that I am less interested in a career that brings me into, into the tower of the university where I sit and have to organize programs or, studies. I like to be in the milieu, outside in the area, to understand what is needed, where are things happening, and to read the signs myself. I think that they are my people, and I understand that it needs sometimes different kind of maybe words, maybe different kind of understandings, and reality is different than maybe theoretical thoughts are teaching us. So I like to adapt everything that I understood and that is maybe important to teach to the reality of the people. So lectures and workshops that I give can be very different if I give it to people that do sex work, if I give it to people that are social workers, or even to doctors, or to students, or maybe to collectives that are organizing a sex positive party. It totally orients on their needs in that moment.
What I find really interesting is that you managed to bridge these two worlds. You get to teach the community, you get to teach the institutions that are important during nightlife, but at the same time, you also reach out to universities and you give lectures to at least two different universities that I found. I found Charité in Berlin, but also the Brandenburg Medical School, where you teach regularly.
They let me.
They let you. When you teach medical students, also young GPs, about all these topics, what's your feeling? How do they react to this field of medicine, which is maybe a bit different, just as you rightly said, to the academic medicine that you might know from other academic subjects?
Probably colleagues, and they look at me with a weird gaze, but the students understood that I try to be very down to earth. So I always try to encourage and motivate to think about what their interests are when they would like to maybe, I don't know, run a clinic or maybe go to the hospital. So I try to orient my lectures and my workshops to these parts. Maybe something that I was missing when I got my education. And mostly they receive it well, and mostly they tell me that it was helpful. But not everyone is talking to me. What do I know? They can say whatever. And mostly I only see the people that are coming afterwards to me and tell me, but that's not everyone. So maybe there are also people that tell me, wow, that was totally not what I expected. I really wanted something else. I don't know.
You've not only worked in Berlin, but you've also worked in Zurich in Switzerland. And Zurich in Switzerland and Berlin in Germany, they are probably very different when it comes to community work, or is it very similar? What do I know?
Actually, the community that I work with is very often a either cis gay male community or a Flinta community.
What does that mean?
Flinta, it's an acronym. Stands for female, lesbian, inter, non-binary, trans, agender, and maybe also for sex workers. They don't really need borders. So that's why I was telling you, it's not only Berlin, it's every bigger city that maybe has lots of traffic, lots of people moving in and out and in and out. And Zurich is one of those. The main capital, Bern, maybe has less of this. But Zurich is a city where lots of people are coming in and out. It is very international. So you have lots of people that are also organized, digital, engage in sexualized substance use or chemsex, that do sex work and organize themselves. Lots of people that live in transition. So there's also lots of transaffirmative care needed. So these are topics that I find in Berlin and in Zurich as well, and probably also in other cities, but I don't speak French. No
Martin,
Spanish.
That's very, very interesting. And I think you've opened up an entire new field of special interests that maybe some of our listeners haven't heard of before. As in all of our podcasts, we've prepared a little game for you. It's adapted from a German podcast. It's called the A and B game. And we have 50 word pairs. And the idea is to pick and choose one of these word pairs as quickly as you can. Don't think about it too much. The idea is to just answer what comes to your mind first. The idea behind it is essentially just try to pick whatever you associate with it.
Terrible. How can you ask me to not think?
Well, you can explain afterwards. There's also a special rule. You might have pairs where you really can't decide, or where you think, oh, that's maybe complicated. Then you can always say skip. Ideally, it's 10%, so 5 times. Well, I'm not going to count it, but that's a bit the idea behind it. And we probably have a few acronyms or abbreviations that we might have to explain afterwards. Are you ready?
For this, definitely not, but go ahead.
All right, here we go. GP practice or hospital?
GP practice.
Acute care or chronic care?
Acute care.
Sexual health or infectious diseases?
Sexual health.
Infectious diseases or GP?
Infectious diseases.
Berlin or Zurich?
Fuck. Zurich.
You can always say skip. City or suburb?
City.
Rural or city?
Rural.
Working alone or working in a team?
Team.
Health initiative supervisor or guest lecturer?
Guest lecturer.
Lecturer or practicing physician?
Practicing physician.
German AIDS Service Organization or BISS? You can always say skip. KISS or BISS?
KISS.
We will get to what it means later. Magazines or books?
Books.
Magazines or podcasts?
Magazines.
Sexual health or sex education?
Education.
Sexual health or chemsex education?
Chemsex education.
Coach for party and club collectives or coach for KISS?
Coach for party and collectives.
Bodywork or manual therapy?
Bodywork.
Plant-based medicine or nutritional medicine?
Nutritional medicine.
Healthy or unhealthy nutrition?
Healthy nutrition.
PrEP or PEP? So PREP or PEP?
PrEP.
HIV medicine or hepatitis medicine?
HIV medicine.
Vaccination checkup appointment or STD consultations?
STD consultation.
Travel medicine or tropical medicine?
Travel medicine.
Traveling or staying at home?
Traveling.
Diagnostics or therapy?
Diagnostics.
Cycling or dancing?
Cycling.
Running or dancing?
Dancing.
Car or bike?
Bike.
Bike or tram?
Bike.
Plane or train?
Bike. Train.
Downbeat music or pop music?
Downbeat forever.
Reading a book or listening to music?
Reading a book.
Music or podcasts?
Music.
Workouts or cultural events?
Cultural events.
Self-employed or salaried doctor?
Self-employed.
Brandenburg Medical School or Charité Berlin?
Charity.
Drug tests or consumer reflection?
Consumer reflection.
GP consultations or preventative healthcare?
Preventative healthcare.
Another abbreviation, DAGNA or AIDS Working Group Berlin?
National, why not?
Yeah, national, all right.
National.
BISS or the German Society for Infectiology?
BIS.
Yes. Checkpoint Berlin or coaching nightclubs?
Coaching nightclubs.
European Society of Clinical Microbiology and Infectious Diseases or European AIDS Clinical Society?
AIDS Clinic Society.
PC or tablet?
PC.
Digital or traditional medicine?
Traditional.
English or German?
English.
German or Swiss German?
Swiss German.
House or flat?
House.
Work or holiday?
Holiday.
Home office or office home?
Home office.
Well-being or success?
Well-being.
Perfect. That was our 50 word pairs. Thank you very much. Were there any word pairs that you wanted to talk about?
My brain is foggy.
Can you maybe tell us what's the difference between KISS and BIS?
KISS is an abbreviation for Kontrolle im selbstbestimmten Substanzgebrauch. I love kissing, of course, but KISS is an abbreviation that means you can use substances, but in a controlled way. For this, you have to learn what control means, and there is a program for it. BIS is our initiative. That is like a Verein, an association that is dealing with chemsex. So both is very interesting. KISS is like a tool that you can learn yourself in order to guide, support people that use substances in order to either get out or learn how to control it. And this is our association that we invested lots of time and sweat.
And that's why you picked it over KISS?
Yeah.
Okay. There were a lot of other abbreviations, one of which was PrEP or PEP, and you were quite fast on
Of
answering.
course. I mean, pre-exposure is always, in every sense, somehow something that you would be interested in post. Wenn das Kind erst in den Brunnen gefallen ist, exactly. When
there was a German saying. Yeah. Thank you. You also said, especially when we talked about Zurich and Berlin, you did pick Zurich. Why did you pick Zurich?
It's really tricky. In Berlin, you can work a lot. In Berlin, there is somehow a work field of the absence. So there's always a void. There are not enough people to do things. There's not much interest to do things. And everyone is like, oh, good idea. Do it. What do I care? Exactly. No one cares. So you can do things. You can unfold things. And you can really, organize also things, which is great. But there's a lot of work and not much care for you and not much help and support. You really have to organize yourself well. But again, there's also lots of space and freedom to fill the void. Zurich is way more organized. But Zurich has a very high life quality. You have these mountains in front of your face and water that you want to swim in. So if you really are interested in life balance of work life, then you would like to have some analog world that is very close and that supports you with calmness. And this is something that I find there.
Okay, so I guess ideally we would have to combine elements from Zurich and Berlin.
I do.
Yeah.
I decided to do.
Yeah. So do you go back and forth a lot?
I commute.
Okay. How often do you go back and forth?
Every month.
Oh, wow. Okay. So you have both worlds essentially.
I work in Zurich, yes.
Oh, wonderful. That's a very interesting way that you set it up. How did you manage to find this sweet spot between clinical practice, running your own GP practice, giving lectures at different medical schools, taking the train between different countries? How did you set this up?
According to my tax guy, you would need a separate seminar and workshop for this, probably another podcast.
Another podcast, okay.
I take the night train, which runs again. I'm really happy for it. Otherwise, the day train. I don't fly. Not because I'm against flying. I think as long as there are wars and as long as like rich private people are flying around, you can fly wherever you want, business or not, whatever. Have fun. I like the train because of the less speed, and I like to look out the windows and to have this feeling of I am distancing myself from somewhere and getting closer to something in a rhythm that I can digest and my molecules are able to traveling with.
It's a very nice image. Thank you.
Also, sleeping is nice in a nice train. You know, it has different people. You share this little space. They also travel with this night train. It's very often very talkative. And I do it regularly. I have fixed times that I do, like cancel myself out here in the clinic. I'm just not here. And then I work in Zurich as a social worker in outreach.
Oh, very interesting. I love it how you manage to self-schedule your entire life that way and have all these different impressions that you get to collect. That's very impressive. Martin, if you think back at the time where you were maybe in medical school or had just started training, and you think about our listeners who might be in one of these stages, is there anything that you would recommend? Or if you think about your own life, is there anything that you would do differently or advice that you would have liked to have? Is there anything that you want to share?
Now you open the huge box of Pandora, basically.
I did, yeah.
When I graduated from the university, I didn't feel equipped enough. And I studied something else, cultural science. And I thought I need more tools. And it was a study in the Viehweger. It was cultural science, ethnology, and Heilkunde. Doesn't even exist anymore. It was just very briefly for a couple of years. And it gave me some more tools and understanding. And in my education after the university, I understood to choose well as many different places as possible for the longest time possible also. That I worked to get to know a lot of pictures, images, cases, patients, to see as many different kind of doctors, how they deal with their work. And that was very helpful. So I really tried to sneak into all these different fields. That provided me with lots of reality and different decision-making processes. This is definitely something I would do again, to not force to finish the education, but to rather have an ongoing process with it as long as possible.
So to look left and right as much as you can.
And to not work fully, always only working part-time, and have time where I do something totally different.
That's very good advice. I think many of our listeners can probably relate to it, and especially if you've listened to all the other podcasts, that sounds very familiar. Martin, thank you very much for your time. Thank you very much for taking time out of your busy workday. And I hope that we haven't kept you for too long, and maybe some of our listeners will join some of your seminars or contact you if they're interested in BIS or your working parties. Thanks, Martin.
Thank you very much. Really nothing to thank me for, that you have the time and that you put out the possibility to talk about those kind of topics that are very often complex and maybe even misunderstood. I'm happy to support you.
Thanks.